One nose, 10 opinions. Let's unpack that. Hello, Tiber. Is it
Hello.
Tiber?
Yes, you can call me as Tiber, but I prefer Tiber.
Okay, I will call you Tiber.
Yes, exactly.
Great.
Because it's a Latin name, that's why.
Oh,
It's not English.
it's not English.
Yeah.
Okay. Doctor, does rhinoplasty cause an addiction? People go the first nose, second nose, third. Is that a Pokemon evolution?
Well, it's all up to a patient because most of the time, most of the patients are satisfied with the result. But sometimes, some patients, they are not very satisfied, even some, if you're going through a surgery, some minor glitches that might happen. For these glitches, you have to be satisfied. But for some patients, even when everything is normal, these patients are seeking for another therapy. But we do not recommend having that many rhinoplasties. Most of the time, if you are having a natural result, I think if you're listening to your plastic surgeon, I think you're not going to be seeking for the second surgery.
And why do people suddenly become confident and DM people's Instagram profile?
Who DMs who?
The patient,
Patients DMs
anyone.
by having the confidence of rhinoplasty, you mean?
Yeah, post-op surgery.
I haven't seen something like that, but it is normal that a person, if they look at the mirror and see that there's something wrong with the face, and after curing that, I think it's normal that they have the confidence, But I haven't seen someone is DMing some other patients, people's Instagram like that.
Does the voice change after the surgery, or it is just like a TikTok drama?
Well, the voice can change, but it is totally physical. It's not mental. Yes. So, yeah, it can, but it's all about the extent of the surgery. Sometimes you have to combine the surgery with rhinoplasty, septal deviation, and adenoidectomy all together, and then you might see that the voice changes.
If a nose is only a few centimeters, why does it feel like after having done the surgery as a personality shift?
These questions are all according to the patient's all experiences can change. It's like, if you have a very big issue with your nose, then of course even changing a centimeter can change many things. And sometimes 1 centimeter, you mean 1 centimeter, but I can spend maybe 2 hours, 3 hours in the operation room to have that 1 centimeter change. So it's not like as you think, it's not very easy to talk about that.
Okay. And do you think the face notices when one part gets more attention than the other part?
The face
Yeah.
or the body, I didn't get it really.
Any part of the body?
I don't think so. Why the hell it gets the realization about that? I don't know.
I don't know either.
I don't think so. It's all about the patient's mind.
Oh, it's psychology now.
Yeah, it's kind of psychological thing.
Great.
Yeah.
So when you say to trust the process,
Yeah.
who is doing the trusting?
both sides. I do the trust process, and the patient should do the trust process, of course. You know, I know the time period that it should be looking normal, but we both have to be trusting the process. Sometimes it might be the first result might be so bizarre, even we think that it's going to end bad, but we are sure at the end of, for example, if it's rhinoplasty, at the end of 6 months to 1 year, you see that trusting the process is the best thing you could ever do, because the result comes miraculously normal and acceptable and very satisfactory for the patient.
Mm-hmm. Thank you for the answer.
You're welcome.
Is the consent something happens once or something that continues during the procedure?
Sorry. Come again, please. I didn't get it.
The consent.
Consent, yes.
Yes.
Patient consent, yeah.
Yeah, of course I'm talking about the patient consent.
Yeah, but I didn't get the question. I didn't hear.
Does it only happens once? Or something that continues during the procedure?
No, you got all the consent from the scratch, from the start. But it's not only a written consent. You have to be spending hours and hours with the patient, explaining the procedure, explaining the results, explaining to anything that can happen to the patient. It's both verbal and written.
And what if something goes wrong?
But if something goes wrong, everything can go wrong. It is a surgery. We are not fixing a car. But we explain. The most important thing about this is, most important thing about a complication is, if you have the guts to correct it, if you don't have it, then you shouldn't start the surgery.
Okay.
You know, I have a microsurgery degree. I treat facial fractures. I can do many things. And I trust myself in this issue.
You do many things.
Yeah.
Great.
And I have done it in the past also.
And when you say a surgery was successful, who decides that?
Of course, the patient decides that. This is this is aesthetic surgery. This is not some other surgery. If you have stomach pain and when the stomach is removed and the pain goes away, doctor can tell you that the operation is successful. If you have a tumor and the tumor is removed completely, you see in the pathology report, then the doctor can tell you that it's 100% successful operation. But for aesthetic surgery, after the surgery, you go out of the operation room, you look at the mirror, at yourself, and you can tell that I have done the best surgery till far, but after the surgery, you show the pictures of the end result to this patient, and if the patient is not satisfied, then it's your disaster, not your success.
Okay. That was understandable.
Yeah.
Is the time part of the treatment or just something patients survive?
Time, sorry. Time what?
Think again, you can do it.
No, I didn't. I don't hear it.
Oh.
Yeah, tell the question again, please.
I can
Please.
pass.
Sorry?
I can pass. I passed.
No,
I passed the question.
just tell me the question.
No. At what point does the expertise stop helping?
No, tell the question before.
I will go back the question.
Yeah, please. I didn't hear it.
Is the time part of the treatment?
Time part?
Yes. Is time part of the treatment or just something patients survive?
No. You know, in plastic surgery, we don't talk about survival and death and this stuff.
What happens?
Yeah, but it's very rare.
Very rare.
Yes, exactly. So we are always, of course, the time is a part of the treatment.
Yes.
Always. Because you have to wait. For rhinoplasty, you have to wait a year. For other surgeries also, there's certain time periods.
Okay. And at what point does the expertise stop helping?
At no point.
To the patient.
There is no limits.
To the patient.
Yeah, there is no limit for your expertise to help the patient. It's limitless. How much expertise you have, you can go beyond your limits all the time.
I like the word.
Yeah.
Beyond your limits.
Beyond your limits. Yeah, that's the thing. It's all about your dedication, all about your work, all about your, experience, all about your expertise. Your expertise is built up with these.
He got it. I'm going to show you a photo of
Okay.
a lady who just had rhinoplasty operation. It's one of your patients.
Okay.
Look at that.
Sorry?
Look.
Yeah.
And on the right side, well done, by the way.
Thank you
Like
for
Paris Fashion Week couture style. Great job.
Thank you. Thank you. I do it all the time. It's
All the time.
all the time I do results. I can give you results like this.
Cool. Great job. I didn't want to make a compliment. I complimented the patient.
Yeah.
She
of
had the
course.
right choice.
Of course. She had the right choice, and she got a very beautiful face, and the result is hence beautiful.
Is she happy now?
Yes, she is.
Do you
indeed.
keep contact
Yeah, you
with her?
you can call her even to your show.
I can call it now.
If you want, yes.
No, I don't.
Why not?
Sorry. It's not my job.
Yeah, you can.
Thank you. That's all.
That's all.
Yeah.
Thanks.
Thank you too.
Eyvallah. It's an expression in Arabic.
In Arabic. Okay. Breathing improved. Boundaries didn't. Work on both.